Welcome. We are really proud of our forum because it has a unique program that the Research Institute, in collaboration, of course, with our long-standing partners, has established for already 6 years. Although the program is always different, 6 years ago it has allowed us to engage and connect various stakeholders in the development of health sociology, and we succeeded. We can see it by the number of people who register to and attend our forum on a regular basis, as well as take part in our satellite events for the issues of sociology of health that we organize almost each quarter before the forum. Also, we can see our achievements by the studies conducted with our partners. Our today's plenary session will cover new behavioral models that, as we witness, have recently emerged in healthcare system. We see that the system should react to them a bit differently than before. For the whole 2024, we have investigated these processes and searched for new, efficient, viable solutions. This year, we have a captivating, multifaceted plenary session that we have gathered a lot of our dear partners who, like us, are interested in the development of sociology of health. So let's move on to the discussion. And I would like to give the floor to our colleague, the representative of Moscow Healthcare Department, the head of the Organizational and Analytical Division, Andrei Girgorov. Please, the floor is yours. Thank you, Elena. Good day, dear colleagues. I'm glad to welcome you at the opening of the 6th Forum Sociology of Health. It's an interesting word combination, and I think the Research Institute has a lot to be proud of. They have created such a platform for discussing the issues at the nexus of two fields that are interconnected, perhaps by a common goal to make people's life better, to make Moscowitz' life and health better. It's an interesting and crucial combination. As you already know, the Moscow government has always pays close attention to the development of healthcare. I believe everyone here knows that Moscow builds a new framework for healthcare services. It includes new polyclinics equipped with the most advanced technologies, new hospitals, new emergency care complexes. You can't help to notice the transformation, new pathways, new approaches, new instruments. However, while implementing all these measures, we sometimes face extraordinary limitations. For example, Moscow has a network of vascular centers across the city. The fastest ambulances in Europe transport patients to the nearest available operating theater with an angiography system. Everything runs like a clockwork. But it turns out that the efficiency of improvements and the allocation of resources largely depend on the time when patients call to the ambulance center, whether they do it immediately after the onset of symptoms, in 1, 6, or 24 hours. It is a key efficiency factor for measures. At the same time, I was surprised when I found that our healthcare system depends largely on sociological limitations and factors, while other mechanisms work with adequate efficiency. So, as Elena mentioned, we should consider behavioral models that are now at the center of special attention according to the present and considerable evidence. We should develop these models, develop guidelines on communication with patients, how to show them the importance of some behavior, for example, medication adherence. You could provide patients with any highly advanced drugs, but they must take it strictly following physicians' recommendations. How to achieve that is a question that physicians could rarely find the answer on themselves. Also, we should consider how physicians feel themselves in such a fast-changing situation. situation when we implement many innovations, like information systems or digital services. It is the very digital transformation. How professional community reacts to the transformation. It is another question for sociological studies that the Research Institute for Healthcare Organization and Medical Management carries out in collaboration with other institutions conducting sociological studies. There is another insight. Sociological studies show us to what extent we are successful at implementing our plans, how Moscow residents, who are the key audience of these transformations, evaluate the outcomes and improvements, how they evaluate what is going on in the city. So, in my opinion, sociology covers more and more activities in healthcare industry, and I hope such valuable collaboration will help us, on the one hand, to grow, develop, and make more informed, rational decisions, on the other hand, to get an objective feedback about how efficient these decisions are. Therefore, I wish you to have a productive day, to gain new insights, to take part in discussions. In fact, there is much to discuss, and sociologists always find a question to discuss. I hope you will enjoy this event in such a beautiful building with an interactive map of Moscow. So, I wish you good luck. Thank you. Thank you, Andrei, for saying that. The venue is really fascinating. Under your feet you see a whole map of Moscow with all the social facilities. And in 2018, when we conceived the idea to organize the Forum Sociology of Health, we were at crossroads in identifying the core of our event. We couldn't choose which way to take for long. Then 2020 began and spurred us to choose the right priorities in our development. In this regard, we received great support from the World Health Organization. At that very moment, an international project was suggested. It connected more than 20 member states from all over the world and was designed to identify new behavioral models among the population that emerged in the context of spreading of novel coronavirus infection and following global optimization of healthcare systems. Our research institute was the first and only participant from the Russian Federation in this international study. It lasted over 2 years. Within this project and under the guidance of World Health Organization, we managed to define our priorities for development, to the point that this year we have fully transformed our Department of Sociology into the Center for Digital Sociology and Socio-Humanistic Technologies in Healthcare. We will discuss that in depth a little later at the sections. While at the plenary session, I would like to give the floor to Batyr Berdyklychev, the representative of World Health Organization in the Russian Federation. The floor is yours. Thank you very much, Elena. Dear participants, dear colleagues, good morning, and thank you very much for inviting me to the forum. Sociology of health definitely plays a key role in building a healthy society in general and human-centered healthcare in particular. Human perspectives, individual characteristics, knowledge, psychology, and level of confidence, all of this should be considered in order to achieve a desirable quality of care and other healthcare goals. The characteristics related to the financial and social conditions of human life or to the current healthcare system should be considered as well. Talking about humans, we have in mind target population groups, as well as healthcare professionals and decision-makers. In this regard, healthcare experts pay more and more attention to instruments usually applied in humanities and social sciences. As one of our key activities, WHO Regional Office for Europe chose to study and register multiple factors of human behavior. A special department for analysis of behavioral and cultural insights of health was established. Assuming time is on our side, I would like to start with a short video that clearly demonstrates this activity.
Public health today is faced with extensive challenges. Cancer, hypertension, epidemics, antimicrobial resistance, the health impacts of climate change, and rising mental health challenges. More than ever, we need innovative, effective, and people-centered approaches. Using behavioral and cultural insights to inform health policies, health services, and health communications offers such an opportunity.
Behaviors are at the heart of most challenges facing public health today. What we eat and drink, how much we exercise, whether we vaccinate or whether we keep to a full course of antibiotics. These are all examples of important health behaviors that are grounded in complex, individual, and social contexts.
Behavioral and Cultural Insights, or BCI, brings together robust methods and evidence to respond to these challenges. BCI can be used by public health authorities to understand health behaviors, the context in which they take place, and how to address the barriers people experience. As examples, such insights have been used to increase vaccine uptake for addressing community-specific barriers and to increase equal access to care through intercultural mediation.
Testing if interventions work, as well as when, for whom and why, is central to BCI. For example, through rigorous evaluation, we know that letters providing social norm feedback to doctors who prescribe more antibiotics than their peers can reduce unnecessary antibiotic prescribing. It has also been documented that labels designed with the use of behavioral science can change our ways and habits for buying healthier food.
It was a milestone event when all member states of the WHO European region in September 2022 unanimously adopted a regional resolution and 5-year plan for behavioral and cultural insights for health.
It's been an absolute pleasure to listen to the interventions from the 26 member states that have made interventions. A recurrent topic was certainly the opportunity of BCI as a powerful, scientifically founded and cost-effective tool.
This was followed by a global resolution in May 2023. In line with the spirit of these documents, WHO Regional Office for Europe established a community of practice with representatives of public health authorities from member states of the region.
Together with this community, we are now going ahead with the first ever regional meeting on this topic. The aim is to advance the implementation of these resolutions and the regional 5-year plan.
The meeting centers on the 5 strategic commitments made by member states: to build support among stakeholders, to conduct BCI research, and to use what we learn to improve outcomes of health-related policies, services, and communications, to commit human and financial resources, and to implement strategic plans. These are ambitious commitments, but if we collaborate and share, and if we invest in this field, we can, and we will, make them come true together.
We see that countries and regions have already made major efforts. Although there is much to do in order to analyze behavioral and cultural insights at the systemic level, WHO currently develops technical resources for supporting countries in relevant questions. We can state that the context and data obtained from countries show a need to create favorable conditions for introducing approaches to analyze behavioral and cultural insights. WHO considers it as a priority and supports countries in extending the use of behavioral and cultural insights. For simplicity, I will call it BCI. Though some activities that we consider as possible focus area that are specific to a country context. But before I move on to specific activities, I would like to describe how BCI toolkit is used in Europe region in general. In 2023, WHO Regional Office for Europe published a report, the first baseline study on BCI. And we know that many countries have relevant experience. They conduct studies and analyze the impact of events aimed at strengthening a desirable behavior. Overall, there is a tendency to strengthen integration of non-medical sciences of healthcare. Meanwhile, such work isn't often integrated in healthcare systems at the routine level. Lack of skills, lack of expertise, and structures for translating data into specific interventions, absence of strategy for BCI implementation, lack of financial and human resources are the main barriers at the country level. Talking about focus areas, firstly, these are political commitments. In September 2022, all member states of Europe region for WHO, including the Russian Federation, supported the adoption of resolution and European Regional Action Framework for Behavioral and Cultural Insights for Health. The text covers 5 strategic commitments, also presented in the video. First of all, the document encourages to create favorable conditions for BCI to work. The next is to create structures and to develop BCI strategies. Aligned with the strategic commitments, countries also strengthen their national structures. A WHO publication that you can see on the slide describes the state of setting up behavioral insights units and provides guidelines on setting up and improving these structures. In addition, WHO is currently working on developing similar guidelines for countries that want to design a BCI strategy or to integrate BCI into ongoing national strategies or plans. WHO also promotes exchange of relevant experience among countries in the region. A BCI community of practice, including representatives of national healthcare authorities, was formed. A regional meeting in 2023 helped to solidify this network of experts. The Ministry of Health of Russia represents the Russian Federation in the community. Generally, creating communities of stakeholders improves the relevant area of expertise at the national and regional levels. Besides that, WHO encourages to improve experts' potential, to strengthen evidence bases, to collect and distribute best practices. Also, WHO technically supports interested countries by providing with resources for increasing potential and awareness and conducting BCI work. First of all, great efforts are made for strengthening potential and educating stakeholders. If you would like to learn more about WHO approach to BCI, there is an online course at our website. As mentioned on the slide, you could complete the course on your own. It's also available in Russian. Also, if you'd like to learn more about BCI work in the region, or to get inspired by cases from other countries or healthcare specialties, or to use illustrative examples for attracting decision makers' attention, you could consult an open access booklet of case examples or any other guidelines published by WHO for supporting BCI work among expert stakeholders. I hope our communication will continue, and our experts in BCI unit are always open for dialogue and cooperation. You have seen almost all of them in the previous video. On this occasion, I couldn't help to thank again the Research Institute for Healthcare Organization and Medical Management for having conducted at a high professional level the study on behavioral insights during the COVID-19 pandemic in 2020. We would like to learn more about your work, your practices, and we are looking forward to a mutual cooperation. Thank you very much. Thank you, Batyr. We are glad to partner with your organization. The key is that we take part in constructing a new research and practice area related to studying behavioral models of the population. And it is fascinating that for a brief period, in fact, for a little over 3 years, WHO has developed multiple methodology and training courses. It is a massive knowledge base that millions of researchers all over the world can use. That's why I'm also very thankful for you to guide us, allow us to find solutions to diverse issues in a creative way at the country level, while providing methodological assistance at the global level. Thank you, Batyr. Let's move on to the next topic. Along with changes in behavioral models of the population, we can state for the last years that almost all developed countries, all metropolises face not a unique, but enormous challenge, and that is aging population. This trend is so much more fast-moving in comparison with 200 or 300 years ago, if we're looking back at history. So, healthcare systems are definitely to be reorganized in a timely manner now, at this very moment. Moscow is a leader in this field, and it is a leader in Russia, and many countries monitor our projects that ensure a stable functioning of social and healthcare systems related to the issue of the aging population. For over a decade, we have been making major efforts to understand scientifically and to implement effectively an initiative for enhancing active, healthy aging of the population. Many Moscovites take part in related projects. In recent years, we have a full-speed build and infrastructure for developing projects and working with the aging population by strengthening its health, solving various clinical tasks, and first of all, achieving quality of life, contributing to mental well-being. So I'd like to give the floor to our colleague, Anna Skorik. She is Deputy Director at the organization leading the project Moscow Longevity. Anna has been immersed in the project from the very beginning. She has a great experience. She has also put into practice her own ideas on the topic. So, Anna, the floor is yours. Please tell us more about this project in Moscow. What results have you already obtained? How these results are used in your organizational activity, what are the prospects, and especially as we are at the Forum Sociology of Health and we speak more about sociology, how sociological instruments that you have applied allow you to successfully run the project in Moscow. Good day, dear colleagues. Elena, thank you very much for the invitation. And of course, I bring greetings from Vladimir Filipov, who is our key driver of sociology development in the Moscow longevity project. Actually, he is the face of Moscow longevity project. I believe it is more about the role of the individual in history. There would be no project if it wasn't for Vladimir Filipov. You are 100% right. As concerning our project, longevity is our everyday agenda, and as you've said, we comprehend and implement it into practice. So we are those practitioners who use sociology to develop the project and even expand it over Moscow. Other regions follow us and come to us, including for consultations on how to create longevity-related projects on their premises. In 2018, a big ecosystem of Moscow longevity has been established. In brief, we have two tracks in our product range. The first is an ecosystem of providers. There are more than 1,000 providers and organizations working in Moscow. The second is Moscow longevity centers. There are more than 130 of them across the city. The centers set up a system for leadership among elderly people, where they can spend free time and in a friendly environment where they can unlock their individual potential. We have genuinely understood that we can't work without sociology, because the topics of old age and longevity are very sensitive and are associated with a great number of taboos and personal views. Before, old age and elderly person were considered as the one big stratum of retired persons. So our task is to decompose not only into socio-demographic characteristics by dividing it into 5 years, as colleagues usually recommend, but also into value orientations or life orientations. We believe that any discussion covering the topic of old age, for example, Kirill, you've recently taken part in such a discussion at the symposium, haven't you? It always ends with one question: why? Therefore, our mission regarding behavioral models is in part to inspire elderly people to live longer and to help them to find their inner support, on the other hand, and to be more resilient to various challenges in the external world. Having that in mind, I suggest to move on to our studies. Today I will cover a part of it. This one might be among the most important, the most insightful for us, in my opinion. We have an impact on elderly people who are our direct beneficiaries, as we usually say. Although they are our participants, the impact of the project is in fact much wider, as elderly persons are usually members of their family systems. They change their life for the better due to our project, and at the same time they change relationships within the family. Our recent study showed that the participation in Moscow longevity project enabled to improve relations with family members, improve relations with children. As we know, improvement in relationship with children has a huge impact on the economy in general, and I'd say on mental well-being in the family unit. It also enabled to improve relations with partners, husbands or wives. And in my experience, middle-aged people, our friends and partners, often come to us understanding that Moscow longevity project can help us and them to find opportunities for their older relatives to spend time more self-efficiently and with profit for their physical and mental health. If we speak about another study where we surveyed not elderly but middle-aged population, 78% of middle-aged people would recommend Moscow longevity project to their seniors. In addition, as I've told before, elderly people become a prime example of healthy lifestyle for middle-aged family members. Benefit from the project is one of the principal aspects that our respondents pay attention to. They put health-promoting effect in the first place. In this case, health-promoting effect is associated not only with the physical activity, sports or trainings in general and so on, but also to other activities like, for example, clubs, classes, knitting, where they improve fine motor skills. The key is that they see this health-promoting effect. Within our studies, we've also started to investigate younger population groups because we understand that longevity issues should be addressed as early as possible, better in utero. Generally, 45 years is the very age when we should think about aging and laying a solid foundation for active life in the old age. So one of our studies covered 45 plus aged people. The participants of the study said that monitoring on health status is crucial to conduct an active, long, full life. It is interesting because 57% of them consider the statement as their own mental construct. However, if I remember right, 45 or 44% of respondents said that they really do something for this goal now. We couldn't say for sure if 57% is a lot or not, but we could see a specific approach in the society where people of younger age groups at 45 years old already think about aging. It is a model that we can develop and extend. Here, I cannot help but thank our colleagues. We hope collaborate with us in order to vigorously develop research activity within Moscow Longevity Project, Elena Aksionova and Ignat Bogdan. Thank you very much for recent studies on mental well-being. I would like to notice that our participants have a high level of mental awareness. For us, it is a sign that we do everything right. And there are many points of growth for engaging more and more elderly people in the project. In fact, there is a stigma for consulting psychologists. In this case, Moscow Longevity Project can serve and actually serves as a friendly, comfortable environment where elderly people can attend classes on psychology or psychological literacy. These are not support groups or psychotherapy groups. Generally, elderly people come with queries related to family issues. And psychological classes create a very friendly environment where our participants can look into themselves to solve their inner questions and improve their quality of life and mental state. In addition, we consider and analyze longevity as a very deep multifactorial model. And we can see that in any study there is a correlation between active social lifestyle and involvement into urban life. Our participants go to parks, theaters, museums twice as often as other seniors. They see themselves as active members of urban ecosystem, urban environment, urban cultural life. However, the most important for us is probably that 96% of Moscow Longevity participants think that the project enhances their quality of life. It is the most important, and what track do they take? Part is actually a secondary concern. Our participants evaluate the level of well-being by 20% higher than non-participants in the same age groups. At the same time, their level of satisfaction is also much higher, so we understand that there is a direct connection between mental health and well-being. There is a similar situation with social activity, and that is linked with digital activity. Engagement with digital technologies is one of the key focus areas for our project in particular. and for global discourse on old age in general. There is a direct correlation. People with higher social activity use digital devices more frequently. They use more mobile internet and vice versa. It is difficult yet to make conclusions. We could only suggest hypotheses in what is primary. What's in it for us? We understand that our participants are by 21% more engaged with mobile internet use. At the same time, this presents a new challenge for us, as higher engagement leads to higher susceptibility to fraud that transforms and evolves every day. So we constantly investigate this problem, and now we're conducting a big study with our partners, for example, with the telecommunication company Beeline, on cyber hygiene and cyber literacy. Returning to segmentation of elderly people, today we have a great ambition to categorize seniors by behavioral models that they use in fraud situations. What are these types of fraudsters? How do they build their strategy, consciously or unconsciously? What are their behavioral patterns? Overall, we have a comprehensive task to protect elderly people and to improve their resilience within this digital environment. Returning to behavioral patterns, behavioral models, we surveyed elderly people, retirees and pre-retirees. We examined what they do and are ready to do in order to build their long-term longevity strategy. And as we can see, investments in health are at the second place. This is also what we should work with, what we should scale up. In addition, we could probably explain that health is an important multifactorial model by covering not only elderly people, but also people of pre-retirement age and younger, since longevity doesn't emerge on its own. And of course, we will be glad to have new partnerships with those who are interested in the development of activities associated with old age and are ready to comprehend this topic. We invite new scientific institutions to cooperate with us, to partner, because our mission is to comprehend old age at the nexus of various disciplines. Since the nexus of various disciplines results in new ideas that could be applied into practice by us or by our partners and could be used to develop Moscow and Russia in order to make longevity a larger trend and to make life of elderly people more comfortable, high quality and sustainable. Thank you very much. Thank you very much, Anna. In fact, I often visit our partners in the longevity centers, and at the very entry I feel the urge to retire. It's such a wonderful place where all is made for people. At the same time, retirement and old age are perceived as natural things within the Moscow Longevity Project. It is really all about longevity, first of all, happy longevity, and then goes healthy, active, and other types. Thank you very much, Anna. While we categorize behavioral models of elderly people within current Moscow projects, there are major efforts made for studying aspects related to sociology of behavior of the working age population. I suppose that most of you are Moscovites, at least those who are in this room, and all of you see how Moscow adapts community spaces to our needs, especially needs of the working age population. These transformations greatly contribute to the economy. New workplaces are created, new interchanges are created in order to make the city more comfortable and efficient for all of us citizens. The Russian Public Opinion Research Center of ЦИОМ is our partner in this area. The research center conducts many studies covering economic processes, development of social sectors, and of course, behavioral models of the population of Moscow and Russia as a whole. We learn a lot from our colleagues, including methodological approaches to conducting studies. I'm always glad to meet a permanent participant in all of our studies and discussions, Kirill Rodin. He is a director for relations with government bodies and a regular speaker on the topics of health and sociology of health. Please, the floor is yours. Thank you very much for inviting me. I would like to particularly thank Elena for the creation of this forum, because sociologists who study healthcare issues usually make speeches at various platforms and jump from one section to another. There are a few events where we can come together and discuss more deeply the issues of how we, sociologists, try to understand health. And the forum, Sociology of Health, is among unique opportunities. I believe all present always wait for this event at the end of the year, especially in order to sum up the results of our forum-related life. What and where did we do? Where did we get the new knowledge? Thank you. Dear colleagues, I give myself permission to phrase the name of presentation in a philosophical way. In fact, I did it on purpose, as I would like to follow one thought based on numbers that I will mention and try to explain today. In my opinion, nowadays, we apply a concept that formed much earlier. I believe it is the very moment when we should discuss the conceptual basis of what we actually call healthy lifestyle. What are the factors contributing, in fact, to the longevity? Generally, the conceptual model where we exist today has a big imbalance towards physical health. Recent discussions address and pay attention to the issues of mental health more and more often. First, it is a very huge deal for professional discussions that we see today. However, in my mind, there is an imbalance toward physical health, especially with the current conceptual model at the level of public projects, national projects conducted according to the concepts of healthy life and longevity that we currently develop. Why, in my opinion, should we make this concept more balanced? If not, we should aim at slightly even prioritizing mental health in the development of current projects. And there are two factors here. Firstly, to my mind, longevity doesn't mean that the person lives longer, strange as it may seem. I believe the key is that the person does not just live longer, but lives as an active member of society, not a dead weight for society that you have to carry as carrying kettles in your hands, but an equal participant who creates the public benefit needed for the purpose of society. It could be done in many ways, but it does not mean that retirees have to work at manufacturers. That's not at all. Everyone has its social function. Everyone has to have it. People should be proactive so they are not dead weight for the economy that in fact pulls on valuable resources, but they become the society members who give those resources. And the second important point, there are several hypotheses, including one that is proven in project. It says that if you have mental health issues, your physical health also suffers as a result. Other speakers have mentioned this too. Why is it important that people give attention to their mental well-being? I would even say horse lives as long as it works. When it stops working, when it decreases its activity, then health and health indicators get lower very quickly. We collaborate with colleagues from the Russian National Project Priorities Project. For example, Yulia Gryznova, head of Directorate for Strategy, Analytics and Research at the National Priorities. She has made an interesting observation why women live longer than men. Retired men go to their garages or lie on the couches, while retired women continue to play an active social role of grandmothers and so on. So let's quickly run through the data. These numbers are taken from our daily surveys, where we do phone interviews with 1,600 Russian citizens, aged not less than 18 years. Margin error is 2.5%. Firstly, regarding health status, the third part of Russians optimistically evaluate their health as good. And we will see, let's move to the next slide. According to the survey of 2019, a third of Russians traditionally evaluated their health as good, and 49% evaluated as satisfactory. Those who evaluate their health as good are, as doctors usually say, under-examined. It's a third of them. Then over 50% evaluated their health as satisfactory. It means that people have already observed some symptoms and supposed to have some health conditions. And almost 16% told us that their health is poor or very poor. Next, regarding adherence to principles of healthy lifestyle, 53% of optimists told us that they always follow a healthy lifestyle, 35% told us that they follow sometimes, and 11% told us that they do not follow. Since all of these issues are so-called socially acceptable, and I can tell you that if we dig really deep into real cases and analyze physical activity and diet, bad habits, and so on, the group size will drastically decrease. For example, we conducted crossover studies, and our results showed that a fifth, maximum a fourth of the Russians really have a healthy lifestyle, according to all the official indicators from the healthy lifestyle concept. So the group is much smaller than the data shows. Next, we asked respondents to specify what having a healthy lifestyle means for them. It was an open question. Here they mentioned 5 key health habits: healthy diet, physical activity, breaking bad habits, and others. And generally, it is the concept that we have promoted for many years. It is in fact publicly acceptable. Everybody understands, at least in terms of social orientation, that they should do to achieve healthy lifestyle. However, everything we talk about only refers to physical health. Then we are going to talk about mental health. Previous question related to physical components, as I said. And the next question that I choose are indicators of what is going on with mental health. Here, 90% of Russians said that they have stress. What is stress? It is a negative psychological state. If making a comparison with physical health, we usually tell that we have a headache or an itch, and so on and so forth. In fact, when 90% of Russians tell us that they have psychological stress, it is actually an indicator, a symptom of poor mental health among population. So we definitely have 90% of patients with mental health issues. Next. We ask them what do they do when having stress or a high distress. They go for a walk, try to calm down, try to relax, do exercises, listen to music, take medications. These are top 5 answers on how Russians act in a psychological difficult situation. Anyway, let's consider psychological care. If still making a comparison with physical health, we get a symptom. We are stressed. If we have a cough, runny nose, body pain, a stitch, a sharp pain, and so on, we visit a doctor. At the level of mental health, 90% of our potential patients tell us that they feel sick, that their mental health is worsening, and at the same time, only 15% of Russians seek psychological care, according to the study. And I don't remember if it was said here then that the questions related to psychological care are taboos, since they are sensitive for considering even in studies and communication within society. For some reason, consulting a psychologist means that you are crazy, disabled, psycho, mad, and so on. We see that society members perceive this issue in different ways. So, we have seen how people seek psychological care in Russia. Then I would like to address the second important point. This point is associated to planning, to making the very medium and long-term life goals that actually push people to stand up from the couch, to take actions, to make choices that build meaning in life, the meaning that gives energy to people, including for having good physical and mental health. We usually tell that we must visit a doctor, we must take care for our own health, but people always answer for themselves the question, why? Why should I? In conscious or subconscious mind. If people do not find the reason why they should visit a doctor, why they should care for their own health, if there could be any reason, for example, that somebody wants to leave to see his or her daughter or son getting married, if there is no answer, no understanding why visit a doctor, why to care for their own health, and believe it or not, people will keep consciously and unconsciously to be beaten path of passive survival. Let's go into detail. As we can see, the slide covers how Russians make plans. Generally, I would say that 40% for certain still tell us that they do not make any plans, and they do not have any such goal. Actually, these are future patients who will see very soon at hospitals, polyclinics, or other health organizations. Let's sum up, colleagues. I would like to finish by the thought which I have started with. In my opinion, if we would like to obtain new qualitative results in life expectancy, if we would like to obtain new qualitative results in audience of healthy lifestyle interventions, we should now pay special attention to fine-tuning the actual concept of healthy lifestyle in the Russian Federation, and as well as the principles that we usually apply to introduce this concept at various levels and in various contexts. Apart from that, I believe we could allow ourselves today, if there is such opportunities at the Forum Sociology of Health or within research projects with our colleagues, to discuss and investigate the topic of mental health from various perspectives. Because I do not know whether there is or not a methodological model of research that is ready for applying. So I consider this as one of the key activities for the future. Maybe next year it will be possible to prioritize this issue in order to explore in depth and to have a brainstorm with all of our colleagues. Thank you very much. Thank you, Kirill. You're 100% right. Mental health is a crucial topic, especially for working-age population. According to several studies, we see that behavioral models and strategies for living to longevity are affected by the quality of life and individual attitude towards oneself and self-esteem. A bit later, we will have time for question-answer session at the end of discussion. Our sociological studies cover one more topic. Within our international research activity, we evaluate emerging organizational technologies. We study and explore them to understand how they are already integrated into the activity of various public authorities at different levels. For example, South Korea actively develops one such activity, That is screening of mental health state, especially in working age population. The screening covers young people of 24 to 34 years old, and they must make a screening visit every 2 years. In fact, the situation with mental health in Korea and Russia is similar. There are a lot of taboos, and people don't want to go to healthcare organizations or rooms of psychological support. People could see no health issues, but their behavioral models change anyway. And we can see these changes through interactions of people with healthcare system. As you may know, our forum is international, so I would like to give floor to our next speaker, a colleague from China, Mao Tian. He is the Vice Dean of the School of Public Health at the Harbin Medical University. Our research institute and Harbin Medical University have a lot in common. For example, we conduct many similar studies that cover various behavioral models and behavioral patterns of the population. Again, we return to the issues of elderly population. Our speaker will tell us how Chinese authorities interact with elderly people, how Chinese government creates favorable conditions for building national strategies on health promotion. Please, Mao Tian, the floor is yours.
Hello everyone, my name is Mao Yi. I'm from School of Public Health of Harbin Medical University. Thank you for the opportunity to present at this very important research seminar today. It's a shame that I couldn't attend in person. My presentation today will be talking about the falls prevention in China. So before we just talking about falls, if we just look at the aging trend in China, we can clearly identify that over the past 2 decades, China is aging really rapidly. And based on the 7th National Census data, that in 2030, there will be about 400 million people above 60 and aged 60 years old and above. So that's representing about nearly 20% of the entire population. And one of the consequences for the aging population, and it could be as a most neglected health conditions, is about falls. So when we're talking about aging, most people will be thinking about cardiovascular diseases, diabetes, but falls is always being neglected in most health services. But if we're looking at the global burden of disease data, fall remain as the leading cause of injury-related mortality among the older people. And we recently conducted a study to estimate the burden of falls in China by using the global burden disease data. And this study has been published in 2021 in Lancet Public Health. And from this study, we found there's a large variation in terms of the estimates of the incidence, mortality, and deaths from the previous literature. And this study is basically to investigate the current burden of falls among the older people at the national and the provincial level in mainland China, and also to explore the trend in terms of the burden of diseases from 1990 to 2019. And we used the global burden of disease data 2019. And from this study, that we can clearly identify that in 2019, the incidence rate, mortality rate, and death rate, they are pretty high in people aged 60 and older in mainland China. And also, if we're looking at the trend between 1990 and 2019, there's a substantial increase in the incidence rate among the older Chinese adults from 1990 to 2019. And if we're looking at the burden of falls by by sex. In terms of female and males, both sex, they experience a pretty large burden in terms of the incidence, mortality, and deaths among the females and the males for people aged 60 and older. And if we compare females and males, we can also clearly identify that males experience a higher incidence rate and mortality rate compared to the females. So from this study, we concluded that between 1990 and 2019, the incidence rate of falls increased substantially in older adults across the mainland China, and falls remain as an ongoing health burden for older people in China. And there is an urgent need to introduce system-wide, integrated, and cost-effective measures to protect or to intervene the older people that can minimize the risk of falls. So following this study, we started to identify what are the current system-level barriers that prevents the evidence-based falls prevention interventions into the existing Chinese health systems. Since 2009, Chinese government started to implement a national program, and this program is called National Essential Public Health Service Package. This package program is being implemented at primary healthcare system levels with the aim to improve the current management of non-communicable diseases as well as on targeted population, including the older people. And as part of this National Essential Public Health Service Package, people aged 65 and above, they are required to provide health checkups on an annual basis, and also falls prevention is part of the program. So in this study, we're trying to identify what are the associated factors that are being associated by implementing the falls preventions in Chinese primary healthcare system. And in addition to that, we're trying to provide recommendations to inform the future better implementations of falls prevention in the Chinese primary healthcare system. So this study is a qualitative study and conducted in 3 provinces. And we interviewed multiple stakeholders that including the health administrators, primary healthcare providers, as well as the older people. And we used the consolidated framework for implementation research to inform the development of the interview guide, as well as to help us to analyze the data. So we totally interviewed 130 participants, and we clearly identified there are multiple barriers to implementing the falls prevention in the Chinese primary healthcare system. So those major barriers include insufficient confidence in delivering the interventions by the primary healthcare providers, and there is a really poor understanding of the falls burden of the primary healthcare providers. In addition to that, low recognitions of the importance of falls prevention and limited multi-sectorial collaborations and weak financial incentives, they are all identified as major barriers from the primary healthcare providers. So from this study, we concluded that there is a need to better integration with the National Essential Public Health Service Package to provide system integrated falls prevention program in the Chinese primary healthcare system. So based on this study, we further conducted a participatory design with the aim to develop an intervention framework to strengthen the integration of falls prevention for older people within the Chinese primary healthcare system. And this study, we're using a participatory design approach with a wide range of stakeholders. So again, this study has been designed as a qualitative participatory design, and we conduct this study in 3 provinces. And those participants include the health administrators, public health professionals, as well as primary healthcare providers. We designed this study as 2 stages. In each of the stages, there are 2 workshops. In stage 1, the first workshop is trying to understand the service procedure and to identify the opportunities for integration. And the second workshop of stage 1 is to optimize the integration within the local primary healthcare system. And in the stage 2 of this participatory design, the first workshop is aims to refine the participants' understanding of how to strengthen the integration, and the last workshop is to develop the specific implementation strategies. So at the end, we identified there are 5 key components in this conceptual framework. So that including the policy, service, workforce, data, and organizations. And in each levels of this framework, there are also specific implementation strategies being proposed by the multiple stakeholders. So for example, in the service component, the participants basically recommend to add to service for patients with diabetes and hypertension to be integrated with their routine management for hypertension and diabetes program, and also to be integrated into the traditional Chinese medicine service, and also has the potential to integrate with other potential services. So basically, rather to provide the falls prevention as a standalone service, but to consider the integration of falls prevention with the existing health services, including hypertension, diabetes, and other existing health services. And also other specific implementation strategies like for the workforce, that including to provide in-service training and also to consider task shifting by involving non-professional healthcare workers be part of the service deliveries. So for the other components, there are also specific implementation strategies for organization, policy, and data. So basically, based on the previous studies, by understanding the burden of falls, understanding what are the barriers, system barriers of implementing falls at the primary healthcare levels, and also to develop a conceptual framework to implement falls prevention at the primary healthcare levels. So based on the results of the previous studies, we are now conducting a falls prevention trial. So this is a large-scale cluster randomized control trial be implemented in 128 rural villages from 4 Chinese provinces with a total sample size of 2,500 older adults. So in this cluster randomized control trial, we aim to evaluate the effect of strength and balance training program on the incidence of falls among the older adults. So we have completed the recruitment and baseline survey, the intervention study from January 2024, and due to complete by the end of next month. So hopefully that at the next opportunity, I can share some main results from this falls prevention trial from 128 villages. So at the end, thank you very much again for this opportunity to share and present our work in falls prevention, and we look forward to future opportunities in collaboration in this area. Thank you.
Thank you. This is an outstanding presentation. It is not only the topic of fall prevention that is interesting here. It is certainly very important. We're also moving in this direction. But the approach of various countries to the transformation of primary care is also of interest. This year has been eventful for the Russian Federation. It marks 150th anniversary of the birth of Nikolai Semashko, our first healthcare organizer. The institute founded by Dr. Semashko also celebrates its 80th anniversary this year. In the post-COVID period, many countries have been conducting various studies aimed at transforming their primary care. The majority of these countries, including China, concluded that the primary care should adhere to a comprehensive approach towards medical care organization. and free medical care should be provided for all population groups, regardless of the healthcare model implemented in the country. Luckily, in Russia, universal health coverage exists for almost 100 years. And Dr. Simashko also has made a huge contribution to it. Importantly, primary care is currently undergoing a dynamic transformation. And Moscow also takes part in this process. As you can see, there are a lot of changes in medical care, medical facilities, medical infrastructure, and which is more important in the organizational approach, including preventive healthcare work and work with population. Our next speaker is Andrei Tizholnikov. He is our very good friend and colleague. He is the chief physician of Moscow Polyclinic number 120 and also the chief specialist of primary medical care in Moscow. Dr. Tizholnikov, the floor is yours. We look forward to hearing about the current changes in Moscow and how the known and new population-based behavioral models are used to provide more qualified and accessible medical care and integrate it into health-preserving activities of the population. Thank you, Elena. Dear colleagues, thank you for participating in this forum. In my opinion, it is a crucial event as all the changes that happen in the healthcare system, especially in primary care, are the result of sociological research. And these studies that are being conducted are essentially shaping the current changes in medical organizations. Firstly, I totally agree with the mayor of Moscow who said that the polyclinics are the reflection of a healthcare system and they have a significant influence on a patient's opinion about the healthcare system. That's why these changes in polyclinic are so important. Generally speaking, as I have said, and as other speakers said previously, all these changes are the result of studies carried out with participation of medical teams and patient community. And later, the results of the studies transform our medical organizations. It's worth mentioning that in order to consider this transformation successful, we require effectual spatial planning and efficient and well-developed infrastructure. And we also need optimization, despite the fact that we are often skeptical about this process. In this case, we understand that all the processes that are realized within medical organizations should be optimal. And let me give you some details about each area. Firstly, spatial planning. It is well known that spatial planning includes effective patient routing, properly built communications, and carefully planned workload for each medical organization, allowing it to efficiently perform its activities. Let me remind you that today Moscow polyclinics have a specific structure. Several branches are operating under one main polyclinic. The branches are smaller in terms of provided services and medical equipment, but the amount of it is enough to meet the main needs of the population in terms of medical care. These are primarily preventive activities, follow-up monitoring of patients with already diagnosed conditions, and of course, all the activities related to acute treatment. Secondly, it is a well-developed infrastructure. Yelena, I hope that your impression about our polyclinics is as good as about Moscow longevity centers, and every time visiting it or being somewhere nearby you wish to undergo a checkup or receive other preventive services. Medical facilities today are really convenient and friendly. Indeed, our medical facilities have a truly healing environment. Notably, every element of furniture, every design solution, every type of equipment are in a certain way the result of a sociological study carried out with participation of patient community, medical staff, and both of them in order to appropriately meet the need of workers and patients. Of course, modern changes include digital transformation, such as electronic medical records. By the way, dear colleagues, the statistics is changing at this very moment. Right now, we're talking about patient records in the electronic system EMIAS. Number of appointments, electronic documents, and medical records is changing. It is definitely worth mentioning that system interfaces for both the patient as the user, as the doctor, are the result of sociological studies. Regular events are held to improve these interfaces and enhance the functionality of these systems. Just yesterday, a new feature was added to the electronic medical card. It is self-monitoring diary that can now be uploaded in audio format or image format, and this is also the result of those studies that are conducted from the point of view of patients' needs. Indeed, as we have already said, all the processes aim to ensure that our patients receive the medical care in accordance with their conditions and needs in the shortest possible time. First of all, these are preventive activities, follow-up monitoring of patients with already diagnosed chronic disease, expertise when patient needs a particular medical document. And each of these cases in the polyclinic is expected to be completed. That is, we're gone from the long-running, continuous, never-ending patient management. Instead, we acknowledge that each of these processes should be optimally structured in order to reduce excess visits to the polyclinic and to consequently save patients' time. If, for example, a patient has an acute condition, the goal is to make a diagnosis, prescribe treatment, and achieve recovery in the shortest time possible. If a patient has a chronic illness, we should effectively arrange the process in terms of provision of medical care, including the monitoring of patient's condition, and this monitoring also fits into a certain completed cycle. Of course, today we can't imagine a medical organization without proper professional development of medical staff. For these purposes, a personal center was established. Centers' educational programs also meet the needs of our patients and doctors. In order to understand what types of education is in demand, a continuous monitoring, assessment of knowledge and needs is carried out. Not only education and infrastructure that are important, but also motivation. It is implemented on every stage. For example, today there are recharge rooms in medical facilities. Also, a set of values have been elaborated. These are not a concept created by press service or PR. These are experience-based principles and foundations that our colleagues adhere to. It is worth mentioning that they were also the result of some strategic meetings and valuable sociological studies. Moreover, these principles have been presented to the medical society and have long been under discussion, and every doctor could give a feedback on each principle. Let me tell you about these 6 principles. These is, first of all, professional competence, but also patient-centered approach, trust, respect, teamwork, and of course, friendliness, which is also very important. I always tell my colleagues that there is no second chance for the first impression. Sometimes when a doctor or other worker is unfriendly, the patient won't have a chance to assess their professional competencies. These crucial principles and values are also important because it is impossible to elaborate a separate algorithm for each patient visit. it is clear that we have basic clinical guidelines, basic standards of communication, but one way or another, each patient and each case that requires medical care is unique. Therefore, we need some basic reference principles that we can adhere to. Well, dear colleagues, we regularly collaborate with the Research Institute, Newsmama, CEOM, and other institutions in terms of conducting various sociological researches. The standards of Moscow polyclinics are also the result of a set of crowdsourcing projects where the changes in medical organizations have been discussed. The suggestions were made by both patients and medical workers. Substantially, these suggestions form the basis of today's transformation of modern primary care and substantially of improvement of every medical facility. And this transformation continues. Public opinion research is regularly conducted. Studies and surveys of the quality of medical care in polyclinics are regularly conducted. Ratings of polyclinics are created. And this is very important for us too. It's an important work as we cater to the needs of Muscovites and their opinion. And of course, those medical organizations that do not find themselves at the top of the rankings can understand what they need to pay attention to in order to improve their work. And here's our latest research. This September, our colleagues from CEOM conducted interviews with both patients and our staff regarding the quality of major repairs and the quality of improvements in medical facilities. Of course, it was generally recognized that the repair was necessary, and secondly, everyone is satisfied with the quality of this repair and are satisfied with the quality of equipment in polyclinics. Today, Moscow medical organizations are indeed the reference ones. Even within the framework of the National Health Care Congress, we had visits from a huge number of delegations from various regions of the Russian Federation and our foreign colleagues. The way the polyclinics look today, the variety of equipment, efficiency of information system, all this makes people really pay attention to the changes and notice what a good medical organization looks like. But let me tell you once again that this would not have been possible without regular interaction with the patient community, regular sociological research, including regular sociological research among staff of medical organizations. Thank you very much. Thank you, Andrei. When I get to the polyclinic, I immediately remember that, after all, environment and infrastructure can also change the way of thinking. And after such a huge renovation of polyclinics, not only the environment that has changed, but also patients' thinking. By now, patients better understand the routine in polyclinics. I think there are less negative stories about interactions with doctors. And the most important thing is that doctors have also changed their minds and have become more patient-oriented and more professional. New environment fits them. They are constantly changing themselves, making themselves better, and improving their interactions with patients. Talking about sociological research and sociology of health, we primarily think about the preventive healthcare model. How can we implement it? What personalized approaches are to be used? But sociological tools are also largely used in clinical practice, that is, in such significant areas as oncology and cardiovascular medicine. In order to change the existing approaches and introduce new treatment methods, it is also important to conduct sociological research and assess the attitude of the population using sociological tools. So our next speaker is Purvish Parikh, the representative from India. He is an expert oncologist, the head of the Department of Clinical Hematology, and we will talk with him about how sociological tools are used in his country to change the healthcare system in terms of oncological services. You're welcome.
Thank you very much for a wonderful invitation to be sharing my thoughts with you today. And my topic is patient expectations and ChatGPT and beyond. I thank the organizers for giving me this opportunity, and I'm sharing some photographs of our family's visit to Russia and Petersburg, and we had a wonderful time out there. So it's really nice to have such fond memories. These are screenshots from a video that was circulating on WhatsApp from Italy. A patient died, and the doctors and the hospital staff had to barricade themselves inside a room to prevent them from being assaulted. So this is an unfortunate state of affairs where violence against doctors is happening all over the world. Now, what is the reason for this? For that, I think we should understand what are the patient's expectations. Now, this is a photograph that I have taken at the airport, and you can see that there are a large number of wheelchairs at the airport. What does that mean? It means that the person's mobility is compromised. They cannot even walk up to the aircraft. However, they want to go around and see the world. So as age advances, comorbidities are there, but the expectations are unrealistic at times. On the left-hand side, you see my family. We are fortunate that 4 generations are alive together. My grandson is 4 years old and my father is 94 years old. So there's a 90-year gap between the two. And why I'm showing you is that this is going to be commoner because life expectancy is increasing. So on the right-hand side, you see an elderly lady of 111 years who has been operated for her cancer by a surgeon who is also elderly, is 68 years old. And that is why both Time Magazine and National Geographic has indicated that our life expectancy is going to exceed 120 years. Now, with that background and the expectations, let us look at certain diseases. So this is an example of lung cancer. Initially, on the left-hand side, you see that we would call them all patients as non-small cell lung cancer. Then we were able to divide them into 3 groups: adenocarcinomas, squamous cell carcinoma, and others. And now, based on molecular changes and driver mutations, we are able to divide them into 30 different types. And based on these 30 different types, we are also treating them different. But if you look at the survival, irrespective of how we are treating them, whether it's chemotherapy or immunotherapy or targeted therapy or combination, the survival has remained unchanged more or less over the years. What that means is that if we can't distinguish or improve the survival, then at least we should take into consideration what patient expects out of treatment. And this is an example of a similar finding for esophageal cancer. And this is on breast cancer. So there are 2 similar drugs, 2 similar efficacies, but the side effects are different. So with ribociclib, you can see that neutropenia and hepatotoxicity is more. And with abemaciclib, there is more diarrhea and thrombocytopenia. So some side effects that we want to avoid should be important way of deciding how to treat the patient. Now let us take the example of 2 people. One is a lawyer who is dependent on speaking in court, and the other is a model who is walking the ramp, and her appearance must be appropriate so that she can continue her profession. In these instances, how we treat the patient has to take into consideration what is their profession and what is their expectation. Treatment and patient expectations is not a new subject. A few months ago, I did a literature search, and you can see that 190,000 hits on patients' expectations from cancer. And this is well studied as well. Systematic literature searches showed 46 studies involving more than 10,465 patients, and various outcomes were reported. This is a more recent prospective study that was done in the Scandinavian countries called the EXPECT study. Now, what is the important thing? This is another study of rotator cuff repair surgery. The doctors, what they feel is shown on the right hand side, and it shows that 72% of doctors are focusing on pain relief. But if you look at what the patient wants, it's pain relief is only number two. The most important thing for the patient is increase in the range of motion of their shoulder. Now, if you don't understand that, obviously patients are going to be disappointed. We decided to do a study to look at the other side of the table. In other words, this is a WhatsApp group of doctors, oncologists, cancer specialists whose near relative had suffered from cancer. And we decided to ask them, what is it that they expect out of the treatment from their relatives? And this was the priority that they had to make in the 6 options that they had: best chance of cure, longest possible survival, least side effects, least visits to the hospital, least out of pocket expenses, or entry into a clinical trial. Now, obviously, as oncologists, we would have expected that everybody selected either best chance of cure or longest possible survival. But that was not the case. True, majority did select that, but there was significant number of doctors who selected least side effects or minimal visits to the hospitals as their first priority while treating their close relatives. We did another study, which was a match pair analysis between patients and their caregivers. And you can see that there are 122 pairs. We divided them into those where the caregiver was living in the same house and not living in the same house. And we further subdivided them into those caregivers who were bearing the cost of the treatment of the patient and who were not bearing the cost. Lo and behold, the choice between what patient wanted and the caregiver wanted was same in only slightly more than half the patients. In 44%, the outcome, the first priority was different between the patient and the caregiver. And therefore, this conflict needs to be resolved as well. Now, when we want to do this and we want to do an efficient job, we should use the tools that are available to us, like, for instance, ChatGPT. And we have written several articles on ChatGPT that were published in the Indian Journal of Medical Sciences, the CRST Journal, and also the Indian Journal of Medical and Pediatric Oncology. But when you look at ChatGPT, our experience is that it is wrong in almost half the times when suggesting a novel research idea. It is wrong in 45% of times when generating data which is often incorrect. And in 20% of the times, it is hallucinating. That means it is giving information as if it is true, but it is fake, and it's very difficult to find this. So we need to move beyond ChatGPT. Now, these are images that were generated by prompt. The prompt was create an image of a serene mountain cabin surrounded by pine trees with mist rolling in. ChatGPT is on the right-hand side, AI is in the middle, and Gemini is on the left-hand side. And they are all fairly reasonable. And this was a photograph that I took from the students who were attending a conference where I was a speaker. And I find that several of the students were using digital devices to make notes. So I took them aside and I asked them, what is it that you do after taking the digital notes? And it's very interesting how students have been innovative in using the technology. So they make the notes, then they compare that to the textbook or the PDF, and then make flashcards, which they use to revise during the examination. And they also share it both at the institution level or the national level so that their job becomes easier. So let us look at some of the tools that can help you beyond ChatGPT. So one is Humana. And what does this do? It is able to read a PDF in such a way that you can query it, interrogate it, and ask questions. So in this particular instance, the PDF is on the right-hand side, and I was asking questions about the toxicity and the efficacy. So the efficacy is shown here. And in the PDF, it highlights the yellow part. where the data is also there. And so also for the toxicity, it was doing that. Now let us look at consensus. I've read a PDF, I've looked at the information available, and I think that I want to do some research. Then first I should do literature research to see whether it is worth doing some additional activities in that subject or not. So consensus helps you. So the first thing that I did was ask them, is it possible to cure childhood cancer? And you can see that there is 100% consensus. What this means is that I do not have to prove this, it is already proven. The next I took is, can we reverse muscle wasting or sarcopenia in frail elderly? And it says that it is possible, that is neither here nor there, in two-thirds of instances. So it means that a lot of people have made an effort to do some studies here, but no concrete results have come out. And then the third question that I asked was, does cancer screening improve all-cause mortality? And here it is very interesting that it's 40% are saying yes, 40% is no. And that means that there is a very good chance that if I do some research in this, it will be useful and then it can get published in a good international journal. So this is how consensus can help. Then we move on to science space or science space. And the idea of doing that is you ask a question. Here what I've asked it is, what is the difference in cancer specific and all-cause mortality? And then it gives bullet points as well as definitions. And below that, you will see that it is giving publications and what is the insight that is obtained from the publication. On the right hand side, you can see the column which shows additional columns that can be added to this based on what exact information you require from this or not. And then you can continue to do that. And finally, if there is a full text which is not available to you, then this tool can actually help you communicate with the corresponding author, and hopefully he will send you the full text article which you may otherwise not have access to. Now let's look at POP AI. Here it helps in two ways. One is AI generated PowerPoint presentations and the other is AI generated medical writing. So for the PowerPoint presentation, I use the title Use of AI Tools to Improve Patient Understanding of Cancer Management. And lo and behold, it gave titles and subtitles so that the PowerPoint presentation can be generated. And in a few seconds, the PowerPoint presentation was ready. It is also possible to tweak this presentation. So you can see that in this particular instance, the visual was not appropriate for successful AI in implementation. And then I asked it to generate some images by artificial intelligence, picked up the image that I was interested in and replaced that in the PowerPoint presentation. So this way, instead of spending half an hour or 1 hour, you can have PowerPoint presentations ready in a matter of 2 to 5 minutes. Now, if you find that the AI generator is not able to create a visual that you want, you can actually use a prompt that can specify what is expected. So in this, I have used 320 words prompt to ask the artificial intelligence to generate a proper visual. And this is how it generated the visual. Then I asked it to make it a person with brown skin. So that changed. Then I asked the person to be elderly. And then I changed the environment to say that it's a busy hospital and there are other people around while the discussion is happening. And finally, I said, imagine that a Russian nurse is explaining to a stout old lady with the help of a chart held in her hand. And that is the image that it was created. Everything is done by artificial intelligence. The other thing I mentioned is artificial intelligent manuscript writing. And here I said, what is the judicious use of AI tools to facilitate studying by medical students? And here you can see that it starts with 0.1 and goes all the way to 6.2 to bring out the entire summary of a manuscript that will talk about judicious use of artificial intelligence. Now you have done all that, you have made a presentation and now you want to make a video. So you have the TurboScribe, which is unlimited audio and video transcription. You can see that here I have made a video in which I'm talking in English, which is the original English video. And then I want to translate it into Russian. So you can see that this TurboScript allows me to have Russian captions as well as a Russian transcription of what I want. And then we have Vozo AI and Veed AI, which actually does the actual translation of the audio as well. I have no idea what I spoke in this, but this is the translation along with the caption that was given. So, to take home message, patient expectations are often different from what we imagine. If we take these into consideration while treating the patients, they will be more satisfied. AI tools beyond ChatGPT make our task more efficient, and we have to work smart in addition to working hard. This can allow us to do a great job beyond language barriers. With that, I thank you very much for a patient hearing, and I hope that my presentation was useful to the audience.
Thank you, Professor Pulrich. Thank you. This fascinating presentation demonstrates the transformation of sociological science in real time. Earlier, talking about the methods of the sociological research, we could choose either questionnaires or focus groups, maybe or a telephone survey. But now, as our colleague from India already said, we can use, for example, virtual assistants to set the task for doctors more clearly and adapt the medical information for patients, and a number of very interesting instruments that our esteemed colleague has presented to us today. That is, we're witnessing the change of sociological science for the benefit of human health and the emergence of a large number of new methods of sociological research, which, in fact, are largely changing clinical practice and healthcare management system. So, I would like to give the floor to the last speaker of our plenary session. It is Ignat Bogdan, head of our Center for Digital Sociology and Socio-Humanistic Technologies in Healthcare. I believe that's the name. The center accurately reflects the idea and our priorities for the next few years in the field of development sociology in the interest of Moscow healthcare. Ignat Bogdan is the founder of this forum. Thanks to him, the idea of creating a forum appeared, bringing together, as Kirill Rodin correctly said, on a single platform all specialists from different fields of knowledge, and those who are interested in the development of sociology for healthcare, for human health. The floor is yours. Thank you. Good day, dear colleagues. I'm very pleased to be the part of this forum held already for the sixth time. I'm happy to see that indeed the idea of synthesizing sociological, socio-humanistic knowledge in general and the knowledge of healthcare organizers, the idea of this forum is active and attracts more and more attention of the general audience and experts, including international experts. In my speech, I would like to present to you 4 brief theses that relate, as you can see from the title of the presentation, to the digital future of social sciences in healthcare. These are the topics that seem very relevant to our center, and these are the topics that, as I can see it, arise as a response to requests from almost all healthcare systems, in response to requests from sociological knowledge in the healthcare system. The main theses are mostly methodological, but at the end of my presentation I will show you some statistics. And our first problem, first challenge, first task, and first goal is the issue of combining data. Today's world, today's healthcare system generates a lot of diverse data, a lot of multimodal data. There is a lot of data becoming available, and at the moment they are not interacting to the necessary extent. That is, if you take a look at certain dashboards, for example, in governmental or private organizations and try to analyze the social issues, you'll see several separate tabs: survey data, social media data, complaints, and they do not interact with each other in any other way. And accordingly, there is a very serious question of finding a way to combine this data. First of all, it raises a theoretical question. For example, we have different data on different tabs. Consequently, they should contain different types of information. However, in fact, these are all social data, but in different perspectives, different reflections of collective consciousness. If these data are different dimensions of collective consciousness, then they should be unified. One could say that this is some kind of theoretical abstract question, but it is in fact a very practical question, because the researcher faces a very serious problem at some point of the work. I mean, there is a separate poll tab, a separate social media data analytics tab, and a separate complaints tab. Let's talk about social media and survey data as an example. In most cases, survey data and social media analytics data contradict each other, and this is where a practical question rises: which data are the main one, which are more trusted in case of a complete contradiction between these data. It was agreed that survey data in relation to collective consciousness are more important because they are more representative. But in fact, in some cases, more and more colleagues argue that in certain situations, other forms of data should be prioritized. For example, social media data can be more relevant than survey data. Accordingly, there is a practical question: which of these data are the main one, and if one of them is not the main, then why do we need we need them all, and why should we consider it? Why can't we monitor only the most important data? As you can see, there is a lack in both applied and theoretical issues. Accordingly, this is a very complex question, because specialists in sociological theory consider it a very practical issue and not interested in it, while specialists in practical sociology are looking for some local solutions, and there is no generalization. Accordingly, this is a very complex question, because specialists in sociological theory consider it as a very practical issue and are not interested in it, while specialists in practical sociology are looking for some local solutions, but there is no generalization. So, looking for approaches to combining data, we have built a general theoretical model which shows exactly how collective consciousness is reflected in various modalities. I'm not going to present it now, as we're running out of time. You can read our article and get a better knowledge of our model. The only thing here I would like to focus on is an important insight arising from this model, and one of the most important keys to connecting data from different modalities. I'm talking about behavioral psychology and psychological profiling, because the drivers that encourage people to use different information channels, for example, to file complaints, to address social media, or take part in surveys, they largely depend on a certain personality type. Let's move on to the second thesis. The importance of understanding a person is also a very serious question from the point of view of our understanding of personality types. It includes the way we understand approaches to a person. Well, my main education is psychology, and I remember that there are a lot of serious challenges in profiling. First of all, various methodologies, different approaches to profiling. It's hard to choose which one is the right one. Secondly, here's a contradiction. There are nice theoretical models that are far from reality, and we have applied data that does not look well. There is no such clear separation, and we say the phrase that journalists don't like, that everything is relative. Sometimes you want to let the world know that the problem is solved, but the data show that people are not so easily divided into types we want to introduce. Then there are complications with labelity of types. For example, answering the questionnaire in the morning, you fit into one type, and in the evening you are a little bit another, because the questionnaire can't exactly reflect the way we think. There are also serious measurement bias, as the questionnaire still works with the products of thinking. And finally, if we want to apply personality typing to practical sociology, especially survey methods, the methodology has to be very brief and discrete. There shouldn't be large MMPI tests or forms with 300 questions. It has to be short and easy. In our approach to this issue, we decided to analyze the profiling upon the language output of a person. That is, we examine the way a person answers the questionnaire or gives a feedback in social media and identify personality types by applying special markers. It is a very important step because we have to understand the core values of a particular person in order to correctly answer the request. And indeed, in our practical work, we can see that different personality types tend to use different communication channels. For example, people with more assertive and loud personality are more common in social media, while some other types prefer survey. We are also working in this field. Here you can see part of the table where we present personality types in relation to healthcare and understanding these types, we can decide what are the best solutions for each of them. Some of them need better visual effects, the others are attracted by functionality rather than visual part. Some need only facts, and the others want to get some respect. And some, on the contrary, don't like when someone makes up to them. So, in order to properly communicate with population, it is really important to understand the personality types. Our third issue is about virtual employees. They are also known as AI consultants or AI employees. As we already know, personality typing is a complicated issue, and it takes plenty of time to learn its aspects, because this work involves all the gained experience too. So it will take a long time to teach it from scratch. And here is where the AI can help us, namely virtual employees. Moreover, we have such a tense labor market today that is, there are not enough personnel, we have short deadlines both in state institutions and in business. Moreover, we have some specifics in state procurement, and, well, the biggest issue for me is the amount of routine work that leaves no place for creative tasks. And finally, in recent years, our wishes have come true. Language models have been actively developing since 2020s, which allow us to make these virtual employees. Their capacities are very affordable. Either we purchase them, for example, through the Sber API, or we deploy a cluster of neural networks. The video card itself is expensive, but considering the total process, it is quite affordable. So we decided to keep up with this trend, and our institute, we have also employed virtual employees, so to say they work part-time, and among them there are virtual psychologists. Each of the employees has an avatar. Of course, talking to a virtual employee, we know that it is a program, but it feels more comfortable to perceive it as if you are talking to a person. And if it's not made by a machine, for example, by encoder Katya. So we made avatars for our employees and gave them names, as it makes users feel more comfortable. These virtual employees are more affordable in terms of the cost. If done properly, they work faster than humans. It's not about just making prompt. Set up properly, there will be much less hallucinations and mistakes. The most important thing is that modern AI solutions allow us to make virtual employees with no IT education. I personally do not have an IT education, but I have made 4 AI employees in my free time. Moreover, recently my project received the prestigious research award, Research of the Future. Thank you. I'm not praising myself. I just want to say that everyone can actually do this. That is very, very accessible today. And what I like about virtual employees, especially virtual consultants, is that it seems to be the future of service, or rather providing reports to the customer, whether it is research or development or business reports. Research provides a lot of product for reflection, a lot of valuable information, especially if it's an R&D with tons of information. And to be honest, it is a pity that customers don't even have the time to read through all of this data, all this information. They prefer a short presentation, but this mess of analytics and conclusions is put away. And now, actually, this particular virtual consultant is a solution that can help us. Virtual consultants can help us to eliminate the fact that the information provided by the professional analysts is underestimated. Also, virtual assistants answers customers' requests. There is no need for us to answer the requests of customers to change this or that, add a new idea, or study other type of data. This is the work that can be done by virtual consultants. They are available around the clock, 7 days a week, and if properly done, make no mistakes. We can add a short presentation to our chatbot, and it takes just about 5 minutes. So, virtual consultant and the customer can chat about the report. Every question about research and development can be discussed with the chatbot. For example, this is my monograph about loyalty that I discussed with chatbot, and so everyone can make this too. It's rather easy. Let's move on to the last thesis. We've been talking about a lot about digital. However, not everyone is so optimistic about technologies as much as I am. As we can learn from survey data and from our colleagues, that many are skeptical about digital technologies. We should monitor the situation in order to understand what people like and what they dislike, as technologies are not just about the product itself. A good AI product is only part of the task. Attitude of the population towards AI, including AI in medicine, highly depends not only on the quality, but on other relevant social stereotypes that should be identified and discussed. And here we have some numbers. Everyone associates sociology with numbers, survey data, percentages and opinions. So here are some results of our recent study on attitude of Moscow population towards AI chatbots. Firstly, we can say that the hype around neural networks that we have seen in the beginning is over. At the end of the year 2022, there was a surge in its popularity. However, over the last year, the growth has been pretty slow and statistically insignificant. From 1/3 to 1/3 of the population have been using generative neural networks to ask about medical issues. It's hard to say whether it's good or bad. Maybe it's mostly good. According to our survey, only about 10% of the population uses generative models for medical purposes. On the other hand, 10% may seem to be a high indicator. There are different attitudes towards the usage of modern neural networks for medical questions. As we can see, the image of AI among population is poor, especially among older generations. It poses some risks, for example, fraud risks, because people do not understand how well developed the neural networks are. Well, neural employees are already an ordinary thing to me. When I'm presenting this to the audience, I feel like I'm talking about something that is well known. But after my speech, some people come to me and tell me that presentation was something new to them. When the opinion of the majority of the population on neural networks is outdated. That's why people often judge about the fraud where AI is involved by the speech, for example, by robotic voice and unnatural extended pauses. Also, thirdly, people often mention the imperfection of algorithms. About 50% of the population do not trust AI technologies due to imperfection of algorithms. That is, they can't achieve something they want by the means of AI. Only 40% of the population say that AI algorithms are well developed, and the majority of people assess the efficiency of AI in medicine by already existing services, that is, notifications and appointments. There is an overall alertness about AI. We're not talking about medical imaging or computer vision, but about chatbots. Our survey was only about chatbots, so computer vision is better perceived by the general public. Consequently, many people argue that chatbots can make mistakes. They are concerned that they are less intelligent, but at the same time, respondents say that the chatbots are much faster and much more polite. Whether it's good or not, it's also a matter of opinion. Overall, there is a need in improving algorithms, hearing the opinions and needs of general population, and developing the algorithms upon this data. It is not about creating something interesting with smart people, but about taking into account usability and UX research and understanding the needs of the population. And it is important to enlighten the public about AI, as we know that we better perceive the things we understand. In conclusion, I would like to say that, as I've already mentioned, I'm optimistic about technologies. I like the changes that happen. I like the opportunities we have. Although I assess my IT knowledge as middle minus and I don't have IT education, I like that I can create such AI products. Accordingly, anyone with not so much IT knowledge but a certain wit can also make such cool IT products. It's great that Moscow constantly focuses on person-oriented approach, because we should not forget about a human in this digital future. Moreover, the more popular digital technologies become, the greater will be the demand for something more human. I mean, when the world became standardized and industrialized, hipsters with the demand for something crafted appeared. Consequently, maybe one day, anti-digital hipsters with the demand for something more human will appear. And again, in this digital future, we should not forget about the human. And if you're looking for digital algorithm, virtual assistants, we can make them for you. Please do not hesitate to contact us. We can create modern socio-humanistic technologies for you. Let's move into this future together. Thank you. Thank you, Ignat. Indeed, our institute has about 7 virtual consultants in a number of divisions. Of course, the majority of them are in Ignat's center. It's exciting that we don't have to pay them. They can answer me even at night. And just imagine, Ignat now has some free time, unlike other divisions. Dear colleagues, I've promised you a question and answer session. We're a bit running out of time, so let's hear just a few questions from the audience. You're welcome. Colleagues, please pass the microphone. Please. Good morning, my name is Boris Primachkin. I represent the journal Median Forum of the Izbachitelny portal. I have a question about doctor-patient relations, especially in such a significant area as oncology. When an oncology patient comes to a doctor, he clearly feels the doctor's burnout. It is inevitable because, as I learned from the statistics, the number of oncology cases in megacities is growing rapidly. Tell me, please, is there any other option rather than visiting an oncologist? Well, that is not only to contact an oncopsychologist, as I already advised, but to add to Yemiasa tab, where patients could write down some impressions and advice from those people who went through this consultation with oncopsychologists. Technically, this specialist is doing the right work, but he's not a doctor. That is, he's not a clinician, but just a doctor. Do you understand my question? Thank you. I do not completely understand the question. Can we add such an option to EMS? Yes. Is it possible to add a feedback tab where patients could share their impressions after consultation? EMS has plenty of services. I think I'll answer this question, and my colleagues can add their opinion later. Yes, there is a feedback service in EMS. There are also oncopsychologists in Moscow, and I think there is a need in enlightening the general society about these options. Colleagues, do you want to add something? Another question, please. My question is this. Every day, doctors see many patients, and consequently, this work significantly influences their mental well-being. And their mental health. Doctors hear a lot of complaints where a patient feels pain and what kind of pain. And of course, this is a tough job. And finally, it influences the patients because they do not receive the attention they need. Do you have in Russia, in any organization, any option to help our doctors? For example, consultations with psychologists after every working day, because the only positive thing that doctor faces during the day are the patients that recovered thanks to their hard work. In my opinion, maybe this is not enough, and doctors need some psychological support or some other help, so they could also live longer, because, as I heard, doctors are not long livers. Thank you. Thank you for your question. I asked Dr. Tizhelnikov to answer you because primary healthcare, he has the leading role in terms of work with staff. Thank you very much. It is a very good and very relevant question. I'm glad to hear that patients also care about doctors' mental health. It's worth mentioning that prevention of professional burnout is one of the top priorities, and we also care about it, and Moscow government and Moscow healthcare department too. For example, this summer in our polyclinics, recharge rooms were opened. When a doctor feels that it is difficult to cope with stress, they can spend their time there. Moreover, new instruments that appear today, including digital ones, made doctors' work easier. You know that previously there have been a lot of jokes about doctors writing. Now we have a generation of doctors who have never written a single word during their work. And it significantly changes the working process. On the one hand, these innovations can make the work of older employees a bit more difficult, but many of them are already accustomed to it. But young doctors can effectively use these instruments. It really helps them to cope with stress, and the issues is pressing and important. Every chief physician always tries to manage it and works with his staff. Thank you very much. Dear colleagues, I think our plenary session is over. There are 3 sections ahead, where we're going to discuss modern instruments of sociological science. We will talk about artificial intelligence, ways to form behavioral models of well-balanced nutrition, as well as interaction between generations, including the issues of mental health. I wish you good luck, and we are waiting for you here in 10 minutes. Thank you.